Welcome to Lecture 10. We've talked about protection, prevention, intervention. Now we're going to be talking about future-proofing your business. It's very important that you take action on mental health at the workplace right now. It's also important that you plan for the future. We are trying to prevent. We're trying to make sure that if we intervene, we do so at the right time, in the right place, and the right method, and it stops mental ill health getting worse. And we're trying to protect ourselves and our employees, both now and in the future. The World Health Organization predicts that depression will be the world's most common illness by 2030, and suggests that the global burden of the condition will be greater than illnesses such as diabetes, heart disease, and cancer. So to tackle this and avoid the detrimental impact poor mental health has on both employees and businesses, employers, that's you probably, must take action on mental health issues as well as providing support when mental health issues happen. This is to try and prevent repeats. So if you become too ill to work mental health issues, that when you recover and work has supported you, it is not repeated. Also, that employees are protected and know how to protect themselves from mental health illness. So think about what actions are you going to take now to try and protect your workforce and yourself, because you are an employee as well. And what actions are you going to take now that will protect your workforce? And what actions are you going to take now that will protect your workforce in the future? So what could you do? You're watching this lecture, whatever day of the week it is. What could you do right now? Well, for example, you could look for signs of poor mental health in yourself, in the people that you work with, your work colleagues, and your workplace. And given all that we've covered, think about what symptoms exist. Think about what protective measures there exist. We're back to healthy living, really. Exercise, eating facilities, delegation, leadership attitude, workload, teamwork. So what can you do today? Secondly, what can you do tomorrow? For example, we've talked about planning for a mental health ambassador. We've talked about scheduling meetings with managers to discuss what training or support they need. We've talked about integrating mental health, putting it on the agenda for any and all staff meetings. We've talked about the data that you need to collect, exit interviews, for example, as well as labour turnover complaints, and even things about the state of the office, the graffiti in the toilets, the hygiene levels. How many people come to work early, ready to start, or is it they come early to avoid the traffic? Also, what can you do next week? For example, compile your insights to inform future decisions, identify new policies or changes or policy changes that could have an impact on mental health in your organisation, and also to put these on the agenda for the next board meeting. So remember, mental health is important for business performance. A business is only as good as its products and its employees. Unless the business is fully automated, the products are only as good as the employees' input. So good mental health is vital. A happy staff, a content staff will not be disruptive, absent high labour turnover, quality problems, lateness, absenteeism. They'll be more engaged, more motivated, and better ambassadors for your place of work. Secondly, line managers need training. Line managers need support to help handle mental health issues day by day. So employees need support. Line managers need support. The head of the departments need support. The head of overall areas needs support. The board of directors needs support. The chief executive officer or chief executive may need support. Everybody needs support. Support they can give, but also support for them to receive. An effective mental health strategy considers prevention, intervention, protection. Prevent, intervene, protect. Prevent, intervene, protect. Remember, remember, remember. Prevent, intervene, protect. And employee benefits are a good way to provide tangible support for staff struggling with their mental health. Okay, the next lecture is entitled A Well-Being Strategy. And we're going to look at the various components of a well-being strategy. But before you move on to the next lecture, as we dealt with this section with prevention, intervention, protection, why not just pause, think about what's been covered, and then put it into practice in the sense that don't watch the next lecture straight away. Take a break. I'm going to take a break. I'm going to walk round the garden, perhaps do something else, sit in the sun. It's a good life. But if you're in a workplace or if you're at home, try and take a break from the study. You'll come back refreshed, you'll come back functioning better, keener, and more likely to participate, more likely to learn, more likely to offer your own insights, more likely to ask questions, give answers, read educational announcements, etc., etc. So you'll be more absorbed. And then look at lecture 11, a well-being strategy.